So we're going over to Claire. Claire, do you want to introduce it?
Thank you, Lorraine. Yeah, my
It's
name.
your presentation.
I'm Clare Barber. I'm an occupational therapist by background, and currently my role is professional services manager at the Disabled Living Foundation. So I'm just going to do a really quick whistle-stop tour around trusted assessors and occupational therapy within DFGs and the kind of support and training that we can provide for that. So I appreciate we're at the very end of a very good and really interesting meeting, so I'll try and make it as quick as possible for you. Just wanted to just a quick display of hands, if possible, to let me know how many of you actually know about the Disabled Living Foundation, or DLF. So quite a few of you there. I can't actually see the chat, that's annoying.
There's quite a few.
Excellent. Thank you.
There's about 10 so far.
Perfect. Okay.
Yeah.
So the charity's been around about
Quite a lot.
Quite a lot. Good.
Yes.
Around 50 years. We do advice for the public, and that's in the form of Living Made Easy, which has literally just launched a new version last week. So please do go and check it out if you haven't seen it. Ask Sarah, which some of you might be aware of, which is a self-assessment tool. And we have a forum called You're Able and a helpline that the public can use. And we find that professionals make quite good use of this, especially trusted assessors, because they can use it with the customers they're working with to help more of a person-centered or person-directed solutions. We also offer services for professionals. So we have a system called DLF Data, which we're actually redesigning at the moment. And if any OTs out there are interested in giving us some feedback or speaking to us about the kind of work that you do and the way that we can support you better, my contact details will be at the end and I'll pop it into the chat. So please do come to me. Our fact sheets are now moving into the professional areas. So there's information on how to assess for certain things, which again, very useful for trusted assessors. And we do conferences around moving and handling and training, which is what I'm here to talk to you about today. So just to give you a brief overview, I don't know if there's any trusted assessors in the group today, or people, I know quite a few of you have mentioned trusted assessors as we've been going through the presentations, but it started out back in 2001. The government recognised that equipment provision wasn't meeting the need. So they pulled resources together from NHS and social care and created ISIS, or integrated community equipment stores. That worked to some extent to get equipment out to the public, but unfortunately they found in 2004 there was a shortage of professionals or a lack of training around provision of equipment. So they created the concept of trusted assessor through a framework that was designed partly with DLF and a company called Assist UK. And that's when DLF started its training. Back in around about 2018, we worked quite closely with foundations and we created Trusted Assessor Assessing and Adapting the Home, which is our level 4 qualification. Actually, one of the people in the chat today, Claire Miller, was very much involved in the process of putting that together. And I'm sure Claire's very happy. Sorry to put you on the spot, Claire, to answer any questions as well around it.
No problem. You'll see me on the foundation's page chipping in, commenting too. No problem.
And Jo Maria obviously has been involved in the past as well. So. But we have trained since starting over 100 different organisations, and that includes things like HIAs, housing associations, social services. We've done surveyors, private companies, public companies, housing officers, kind of real multiple professionals, lots of different types of places. And we've actually passed over 300 learners. And I say passed because we don't pass everybody. It is a qualification, and we are very careful about who gets the accreditation, because we want to make sure that people out there have understood. So we have a very sort of strict rule of when people can assess and when they can't assess if they're a trusted assessor. We have a list of kind of rules to guide them, which is actually in the adaptations of that delay document. And it kind of states that if the person is a complex case, then they should be referring it on to an occupational therapist. If the environment is complex, they should refer it to an occupational therapist. And if there are multiple things going on within the home, then again, it needs to be an OT's decision. Throughout the course, it's very clear that trusted assessors have a very clear line as to when they can and cannot assess. So the benefits that we found so far is it's reduced waiting times for people to actually get DFGs through. And actually after a survey we completed, 45% agreed that that is the case. It reduces the risk because obviously people get the adaptations they need a lot more quickly. It might prevent falls, hospital admissions, increased customer satisfaction, and again around 45% of the people surveyed stated that they had a better service because things were moved along a lot quicker, and in some cases the trusted assessor were people they already knew and trusted, so it helped with that process. Staff that work in these environments have had their confidence increased and are able to make recommendations with a little bit more conviction behind what they say. And obviously, if you invest in the staff, they are likely to stay longer, so there's increased satisfaction. Obviously, and I hate to say reduced costs, but trusted assessors can then reduce the workload for occupational therapists, which means that OTs can be given more time for the more complex assessments that they need to be involved in. We found also that it helps to integrate services better because trusted assessors are usually people that aren't primarily in the assessing role. So surveyors, we've trained people in manufacturers and suppliers, but it helps to bridge that gap between what an OT does and what maybe a surveyor does, and it helps them have a bit more of appreciation to why OTs say what they say or do what they do, and it's sort of made the service a little bit more integrated in that way. Also helped with, we've seen some cases because of the COVID-19 help because trusted assessors may already be visiting for other reasons, and it's meant that they, and I think a lot of people have demonstrated here, can do those low-level assessments because they're already there and they're already doing a different job. So it's actually helped be able to get to those people that we wouldn't necessarily have gotten to because of the COVID-19. There are some challenges, and obviously we do always recommend that when you're trained as a level 4 trusted assessor that you should have somebody mentoring you like an occupational therapist. So there needs to be someone within the team to provide ongoing support. We have had a lot of occupational therapists not keen on trusted assessors in DFG assessment owing to the possible mistakes they might make. So there has been, and it has, I have to say, over the 4 years been 3 years, been a lot better now. It was quite a big issue when we first started, but I think occupational therapists now are recognising that there is a very strict line as to where they can and cannot assess. Although COVID has been a benefit in having trusted assessors, it has also been a struggle. So we've not been able to deliver our level 4 because we really strongly feel that we have to do a face-to-face approach. So we had stopped training, and we are starting again this month from a blended approach. So we're doing some virtual training, e-learning, and still a day's face-to-face to get through that practical stuff. But it also makes it more difficult when you're out in the field because a lot of assessments are being done on the phone. We wouldn't recommend that that's done for the first time with a trusted assessor. Obviously, prior knowledge, sometimes we do get people come through, and like I said, we don't pass everybody. So we do recommend that people have that prior knowledge or are working in the field beforehand because, again, we don't pass everybody. You need to have some prior experience or understanding that things like bath boards, grab rails may not be appropriate in certain cases. There are blanket policies that tend to get in the way of our training because we try and make it as person-centered as possible, and understandably people want to make processes safer. So we do come up a lot with people saying, well, we can't do that in our area because we have a policy that says no, and a lot of people are using trusted assessors wrongly, so we don't condone that in any way. But also for occupational therapists, we're aware, I know as an OT, when I came out of university, I was a bit like, oh my God, what do I do now? How do I know what to do when it comes to adaptations? I have an understanding of assessment, but I have no idea what equipment's on the market unless I'd done a placement in it. Unfortunately, I didn't. So we do have a course that is aimed at occupational therapists, which is accredited at level 5, and it will go through the 5 different types of major adaptations that you're likely to come across. You can do 1 module, you can do 5 modules, you can do a mixture of 1 to 5, but you have to have 3 of those to gain an accreditation. And it is really to consolidate what you're learning, to provide CPD, to test your skills through case studies, to practice what you know, or to try and provide some sort of standard across the board if you're in a team, that you're all working to the same sort of process. And that rolls out from April onwards this year. So take a breath. That's it from me. If you want any more information about anything that we do, my contact details are on there. Or if you just want to chat about what Trusted Assessors do, or anything like that, by all means, drop me an email. But